Currently, THC is the compound that's being tested by roadside tests. I've got the question in front of me. It reads, what's being done about driving? It's unacceptable that a law-abiding person who is undergoing lawfully prescribed medicinal cannabis therapy runs the risk of an antiquated positive roadside test, a test which confirms the presence but not the intensity of the medication, and patients are scared to drive. So, yeah, I guess they make a really good point there. The fact that medicinal cannabis sometimes does contain THC does bar people from driving, and unfortunately it isn't and it is an antiquated law. The government actually doesn't really know where to set the threshold if it was to allow for people to drive when they use medicinal cannabis. I guess that's the key point here. When people take medicinal cannabis or recreational cannabis, they have very different responses. It's highly variable as to what your response will be when you took it. If you've never had THC before in your system, a very small dose may get you impaired enough that you really shouldn't be driving. If you're a regular user of THC, say recreational users who take it on a regular basis, then they may be able to take a really big dose and have high levels of THC in their bloodstream and still be unimpaired to be able to drive. So the government doesn't really know where to put that threshold as to say, what we definitely think is a safe level to drive. There, if we were to do a urine test or a blood test or a saliva test, we know how much is in those areas that we're testing, but we just don't know how much it's really impairing the patient. So they've just put a blanket rule saying, anything more than 0% theoretically should be breaking the threshold, and you should not be driving with that. Even though we don't necessarily agree with it, is that you shouldn't really be driving when using medicinal cannabis. With the one exception being if you were to use a CBD isolate, a pure CBD isolate. What is being done to change that? There is a lot of lobbying done at the state and federal levels at the moment to hopefully have these laws amended. Hopefully, in the near future, we're going to see some of these laws change in a positive manner, meaning that we might go to functional testing like they're doing in Canada. So Canada's implemented a program where you can actually, if they detect THC in your system, they usually call a senior officer, police officer, to come and assess you with a functional test, a roadside functional test, sort of like a walk in a straight line, finger nose test, and do some specialist tests to see whether you are genuinely impaired. If you were impaired, then you'd be breaking the law there. But I think implementing something like that in Australia would be a very useful method to help sort of gauge how people are whether they're impaired or not.